All right, Steve, thanks. 723 on the Paul W. Smith Show, and we mentioned that we were looking forward to a conversation with Dr. Ted Schreiber, Cardiovascular Institute president, DMC Heart Care, and the new heart hospital. We had a hand in being there for the opening, for the groundbreaking. Excited about that, and wanted to touch base with Dr. Schreiber, find out how it's going, and then also with some breakthrough information of the DMC Heart Care specialist, first in the Midwest to implement this robotic-assisted revascularization to relieve arterial blockages. Doc, good morning to you.
Good morning, Paul W.
I hope you're well, and I hope things are moving along on the new heart hospital.
I am well, and things are moving along extremely well and rapidly. So the steel structure is all up. It's if you drive down Mac from 75, you'll see the imposing construction going up, and this time next year, we should be ready for back-end use of this marvelous building.
Excellent. I think people can follow along, too, if they go to dmc.org, dmc.org, and follow along some of the construction. Kind of fun to watch. Meanwhile, a major breakthrough, and there's been all of this move for quite some time for minimally invasive operations and anything that people are doing now in medicine, doctors are doing. They try to be as minimally as invasive as possible, and much of this is robotic assisted, and there's some sort of a breakthrough in your area now. Can you tell us about it?
Absolutely. We're very excited about this. On Monday, we were the first institution west of the Appalachians in the United States, and only the third in the United States, to use a robotic device to perform an already very minimally invasive procedure that is fixing coronary blockages through a catheter, commonly known as coronary angioplasty. I think all the listeners know that we've made great advances at the DMC Cardiovascular Institute and other fine institutions in the state to now fix pretty much every single blockage in the arteries of the heart without an open incision. But the traditional way this has been done, and it's been done for 34 years, is you have your friendly invasive interventional cardiologist right next to your groin, right next to the X-ray camera, pushing the various stent and balloon catheters through a catheter. That involves a fair amount of radiation exposure to the doctor, some radiation exposure to the patient, and it's a traditional way. Now, using robotic technique, the interventional cardiologist can sit at the station 20 or 30 feet away, free of radiation, not having to wear a lead collar, and using marvelously precise technique, exactly deploy the stent in the blockage, making the procedure briefer, safer, and consuming less resources.
All right, I want to talk very specifically about a couple of those things. Dr. Theodore Schreiber here with us. He is well known as the top in his field, and we're going to talk a little bit more about this now. Minimally invasive, and we hope certainly better technique. I got a quick question. I might be confused about something, which is not a surprise. But let's clear up any confusion about traffic right now with Dana Clark.
Watching 4 accidents this time around, Paul W., as your Thursday morning commute gets into full
30s, 36 to 38, 28 degrees, WJR. Dr. Ted Schreiber with us, and he always brings to us some interesting bits of information having to do with the heart. Cardiovascular Institute president, the Heart Hospital, DMC Heart Care specialist. Am I confusing this, Dr. Schreiber, with something I heard recently about being able to do a catheterization of the heart through the arm instead of the groin, or is that a whole different process?
Well, to deliver the stent or angioplasty balloon, you have to go through an arterial route. Traditionally, that's done for the groin artery, the femoral artery. But for a few years now, using the artery and the wrist has been a common and now becoming standard technique. And we do that in about a third to a half of our patients at Cardiovascular Institute. What we've done on Monday is combine the radial technique with the use of the robot. The radial technique permits the patient to get up off the table and sit up at the end of the procedure, and to walk around and be discharged home the same day in many cases.
Wow.
The robotic technique has never been used anywhere in the United States for the radial artery route, for the wrist route. So here we're combining two major advances to permit enhanced safety, convenience, and wiser resource consumption. And that's new. We did it on Monday.
Well, that's exciting. Now, when you do something like that, do you have to say to the patient, I don't want to know who the patient was, but obviously, but do you have to say to the patient, hey, you know what, we're thinking about trying this new technique, and we'd like to try it on you?
Actually, we did say that to the patient. Now, this is the technique, and the use of the CorPath robot is FDA approved. This is not something investigational. There was a previous clinical investigation that was concluded a year ago showing that this technique is more safe than standard human-guided angioplasty and better on resource consumption. So we're not doing something investigational, but we always tell the patient, this is what we're going to do, this is how we're going to do it. And, our first patient, 85-year-old grandmother, said, wow, this is great. I want to be the first one.
Good for Grandma. All right. Are you seeing any fewer blockages, Dr. Schreiber, because of lifestyle, diet, and exercise, or are you still seeing the same amount or more blockages?
Well, what we're seeing, Paul, is fewer younger and middle-aged patients coming in with heart attacks or so-called acute coronary syndromes. On the other end of the spectrum, however, we're seeing many older folks, sicker folks who are living longer because of medical advances come in with acute coronary syndromes. Overall, thanks to preventive techniques, thanks to cholesterol-lowering drugs, cessation of smoking, there has been a decrease in our state and other states of the country in bypass surgery, about 1/3 overall in the last decade, and the flattening out of the need for coronary angioplasty. So yes, there are fewer blockages overall, but as people live longer and more people become diabetic because they're overweight and don't exercise, we're going to see a resurgence again in the next decade or so.
Yeah. Eat less food, get more sleep, exercise more, some simple things, but it's not easy for behavioral modification, is it?
No.
You were going to say?
I was going to say it's much easier to innovate when it comes to technology than basic behavioral difficulties, and the latter is so much more effective on a population basis in preventing disease.
Yeah.
So yes, we can innovate how to get a stent from your wrist to your heart with the doctor being 30 feet away. But we're still at it on how to get people to exercise more and eat better.
Dr. Theodore Schreiber, the Cardiovascular Institute president, congratulations on this breakthrough. Another one on Monday, and we'll talk again soon, and we'll see you soon.
Look forward to it. Have a good day.
Thanks, Doc. You too, Dr. Ted Schreiber. All-around good guy. You can follow dmc.org for some of that information. Fascinating stuff. All good for us.